Hello guys, I'm in a clinical congress organized by the American College of Surgeons. I'm in San Francisco, California. This is a Moscow Convention Center, and within a few minutes I will start to record an interview with a great surgeon. He's an oncosurgeon. He's named Dr. Mikhail. Hope you will enjoy watching. Good luck. Hello guys, today I'm going to record an interview with my college. He's a surgeon from USA. Main purpose of recording this lecture, this interview, it's for you guys, and plus to share with my college once I will come back to Belarus, and I will show to my college also, and I want to show to you also guys. And can you introduce yourself, please?
Yeah, I'm Dr. Rauf Mikhail. I'm a surgical oncologist.
Yes.
I practice in Michigan, and I'm a clinical professor of surgery at Michigan State University in Michigan.
Okay. Dr. Mikhail, can you explain, please, for my followers, like who deserve to be surgeon, and should future surgeon have some quality before even he became surgeon?
Yeah, well, anybody deserves to be whatever they feel like being if they have the interest and the willpower to persevere. To become a surgeon is a great sacrifice because surgery becomes like a pivotal and central part of your life. So you cannot be a surgeon and a successful surgeon if you really don't love the specialty.
Okay.
So you can't just say, oh, this is something I'll do just because it's cool or something that's interesting. You have to really love the work, because this is what you'll do the rest of your life.
Okay. And second question, Dr. Mikhail, what do you will advise for future surgeons, maybe they are also doctors listening me, how to prevent burnout in the surgical specialty? Because there's also high risk in
Right,
burnout.
yeah, that's a very, very hot topic about burnout amongst doctors in general, but surgeons in particular. So to avoid burnout, you really have to have, number one, you should be interested in the work that you're doing. So a person who's interested in surgery is a little bit less likely to be burned out. Number two, you have to have a balanced life. So you can't have just surgery 24/7, 365 days a year.
Yes.
You should have a balanced life, meaning that you kind of prioritize things in your life. So for example, you say, I'm going to go exercise 3 times a week or 4 times a week, and say this time is like devoted to exercise. I'm not gonna do surgery. I'm not gonna have my phone on me and answer any phone call. So these are things that will help prevent burnout.
Prevent burnout, okay. And also I want to ask a question, how to become surgeon in the USA?
Yeah, if you are a foreign medical graduate, or
Yes.
we call them IMG, to become a surgeon in the USA, you have to, number one, pass step 1 and step 2 of the USMLE.
Okay.
And usually they require a score of above 220.
220?
Yeah, to be considered a viable candidate.
Okay.
And the third thing is that you should, if you're already out of medical school, you shouldn't be out of medical school for a very long time, because they don't really want to have somebody who's out of school for more than 10 years apply. And if you have a surgical background, of course, that's very helpful. So if I'm a program director and I see somebody who has 3 years of surgical experience, I would rather take that person than somebody who's never had any surgical exposure.
And gap also between the graduation, yes, also very important. All graduate is very difficult to find, maybe.
It is. It's hard.
I heard they have some filters for all graduate people. They even they can't see this all graduate people when they sending own application for that, for programs.
They do. They have filters. I'm not familiar of how many years is it from medical school, but they have filters. So they have like a filter for step 1 performance, filter for step 2 performance, filter for how many years from the time of graduation you're applying.
Okay, and letter of recommendation also important, yes?
Letters of recommendation are extremely important. So if you have good letters of recommendation, particularly if you have good letters from the chairman of the department of where you're working, that carries a lot of weight.
Okay. Letter of recommendation should be from US doctor, or it's also available if it will be from outside, from USA, for example, in Russia, in any country?
Well, I think...
which one much more valuable?
I think if you're applying from outside of the USA, then a letter of recommendation from where you're coming from is important. But if you've worked in the US with somebody and you can get a letter of recommendation from a surgeon in the US, that's also...
It's much more heavy, yes?
It's yeah, I think it carries more weight.
Okay.
Because you have to submit 3 letters of recommendation.
Okay, okay. And generally about score for general surgeon, yes, it's like it's for IMGs, it should be a little bit higher than US citizens, yes,
Yeah,
to a little bit much more competition going on.
Yeah, it is. Unfortunately, you're right. For IMGs, it should be higher than what I mentioned earlier. So you should be above 230, probably.
Above the 230,
Yeah.
yes. Okay, okay. And how you become surgeon? Why you choose this specialty? Can you explain, Dr. Mikhail?
Well, you know, I've been a surgeon since 1981. So I was enamored by the specialty because it kind of is a specialty where you can have immediate results of what you did.
Okay.
As opposed to, say, treating somebody with heart failure or somebody with arthritis.
Yes, yes, yes.
So it's an immediate self of gratification when you treat a patient with a surgical problem. Say somebody who was shot and comes in with a perforated liver and colon, and you treat them, and then a week later they're alive.
Yes, everything visible immediately.
Yeah.
Okay. Because of that, you chose surgery.
Yeah.
Okay. And after you subspecialized for oncology, yes?
Oncologic surgery.
Oncologic surgery.
Yeah.
Why you like this oncologic surgery? Because...
Well, a lot of times when you're in training, you kind of develop a kind of affinity for a certain field because of who you train with. So a lot of times, if you train with a surgeon who's a very good role model for what you're doing, and you see that this guy or this lady is doing a phenomenal job with you know, the surgery that they're doing, you say, I want to be like this person in the future.
Yes,
so role model is very important in this field.
Yes, yes. Okay, and can you, Dr. Mikhail, advise for my followers, they around 75-80% students and around 10% resident and 5% maybe doctors. Can you advise for students how they should study to become a great doctor?
Yeah.
At which point they have to stress?
Right. Yeah, I think that, you know, for younger people, particularly students, with the availability of the internet, it's very tempting to kind of study for the exam or study to become a good doctor. These are two different things. So study for the exam, you have a lot of question banks and you can become very good at answering those questions, but you won't have a good grasp of medicine if you don't read the textbook.
Yes.
So you have to read the textbook to really understand the pathophysiology of the disease, and then you should kind of supplement that reading with the reading of like question banks and so forth.
Okay.
So having said that, if you want to score high on USMLE, question banks are a must.
Important, yes.
That's extremely important. So
unfortunately, we have to stress in question bank rather than in book.
The question banks are very, very important, but if you have the time, you should really also read the textbook.
Okay, we have to read textbooks also. And much more also practice also in the hospitals also will help to be a good doctor. Yes.
Yeah.
Okay, okay. And finally, I have a question, a little bit philosophically question. What's the secret of success in life? What you can tell about that? And meaning of life and secret of success of life?
The secret of success in life,
yes,
is to have a very good disposition about life.
Okay.
So if you look at the glass half empty versus looking at the glass half full.
Okay.
So if you have a disposition of looking at the glass half full all the time, you will be successful in your life.
Okay.
So in life, no matter how hard you try, there are setbacks and there's a lot of disappointments.
Exactly.
And setbacks and disappointments, they can either bring you down if you look at the glass half full, if you look at the glass half empty, or if you look at the glass half full, they can motivate you to just go over, get over this hump and move on, and let's just turn a new page, keep smiling and keep going on.
Okay. Thank you so much,
It's my
Dr.
pleasure,
Mikhail.
and good
Thank
luck
you
to
so
you.
much. I'm so
Yeah.
appreciate, so
It's my
thankful. Thank you
pleasure.
so much.
Thanks.
Good luck.
Yeah.
Thank you.